Hi everyone, welcome to the Merits Medical Plan Overview. In this video, I'll be giving you an overview of the medical plans we offer to Merits employees, which are administered by Cigna. All regular full-time employees and part-time employees who are determined to qualify under ACA guidelines by working 30 or more hours per week are eligible for coverage. Please note that there are separate videos for overviews of the prescription coverage and health savings account, which are automatically included with your medical plan election. Be sure to check those out too. The Merits Medical Plans with Cigna are consumer-driven health plans, or CDHPs, which both use the open access network of providers. When you use providers in this network, you receive greater benefits through in-network provider discounts and other benefit design differences, which I'll share later in this video. New for 2025, there will be a second medical plan option offered. You may be interested in this option if you typically use the plan for preventive care or have low utilization of the health plan and prefer the plan option with the lowest premium, but you are willing to pay more at the time of care in the event you do have other non-preventive medical expenses occur during the year. I'll show you the differences between the new plan and our current plan on the next slide. If you choose this plan option, you may want to consider adding the Voya voluntary plans, such as the accident, critical illness, or hospital plans, which can help you by offsetting that higher deductible. You also may want to consider increasing the amount of your HSA contributions so that you can pay for your out-of-pocket expenses with pre-tax dollars. As a result of our claims experience in 2024 and anticipated experience for 2025, our current medical plan will have an increase in employee payroll contributions for 2025. To reduce the amount of increase in employee rates, the deductibles and out-of-pocket maximums for this plan will also be increasing for 2025. The in-network deductible is increasing from $2,000 to $2,300 for employee-only coverage and from $4,000 to $4,600 for all other coverage tiers. The in-network out-of-pocket maximum is increasing from $4,000 to $4,600 for employee-only coverage and from $8,000 to $9,200 for all other coverage tiers. The out-of-network limit changes are shown on the next slide. We want to encourage you to continue using cost comparison tools available, such as Healthcare Blue Book, to seek the best care at the lowest cost to fight the increasing cost of healthcare. To differentiate the plans, we will begin referring to our current plan option as the 2300 plan or the 2300 deductible plan, and we'll refer to the new medical plan option as the 4000 plan or the 4000 deductible plan. The chart on this slide shows the semi-monthly rate you'll have deducted from each of your paychecks, depending on which medical plan and coverage tier you elect. The first column shows the amount you'll see in the deductions portion of your paycheck for the medical plan contribution. The middle column shows the amount you'll see as a separate line item in the earnings portion of your check if you're eligible to receive the well credit. The well credit is a separate line item on your check and not combined on the same line as your medical plan deduction. For details and information regarding the wellness program for next year, go to meritsbenefits.com and select the Healthy You Wellness Program link under the Wellness tab. The bottom section of this slide shows a comparison of the deductibles, out-of-pocket maximums, and Merit's HSA contributions for each plan. As you can see, the new medical plan option has lower employee payroll contributions and Merit's contributions for the HSA, with higher deductibles and out-of-pocket maximums than the current medical plan offered in 2024. If you look at the deductibles and out-of-pocket maximums in this chart, you will see that the $2,300 deductible plan has a true family deductible and an embedded out-of-pocket maximum. The $4,000 deductible plan has an embedded deductible and an embedded out-of-pocket maximum. I'll explain what that means on the next slide. True family deductible means the full family deductible must be met before any member's claims are paid by the plan. An embedded deductible means one family member only needs to meet the individual deductible before the plan begins to pay on their claims instead of having to meet the full family deductible, while the rest of the family members' claims continue to apply to the remaining family deductible. An embedded out-of-pocket maximum means one family member only needs to meet the individual out-of-pocket maximum before the plan begins to pay 100% of their claims instead of meeting the whole family out-of-pocket maximum, while the rest of the family members' claims continue to apply to the remaining family out-of-pocket maximum before their claims begin to be paid at 100% the rest of the calendar year. Here's an example to explain how these differences work. Mike has family coverage with his wife Emma and son Mason. Emma incurred medical expenses during the year that totaled $8,000. All of her providers were in network. Mike and Mason have not had any claims this year. They are enrolled in the medical plan that has a $2,300 individual or $4,600 family deductible. For this plan, Emma has to satisfy the full $4,600 family deductible before the plan will pay any of her claims, since it is a true family deductible. However, since this plan has an embedded out-of-pocket maximum, she only has to satisfy the individual out-of-pocket limit of $4,600, which happens to be the same as the family deductible on this plan. Since that has already been satisfied, the plan will pay the remaining $3,400 at 100%, and Emma's total cost on this claim is $4,600. If that plan had been an embedded deductible, Emma would only need to satisfy the individual deductible of $2,300. Then the plan would pay 80% of the remaining $5,700 or $44,560, and Emma would have paid the remaining 20% or $1,140, and Emma's total cost would have been $3,440 instead of paying the $4,600 that she had to pay under the true family deductible plan. This chart shows the percentage both plans will pay for services once the deductible has been satisfied and before the out-of-pocket maximum has been satisfied. The out-of-pocket maximum consists of amounts that are applied to your annual deductible plus the coinsurance or percentage you pay after that, which is 20% in-network or 40% out-of-network for most services. Once that out-of-pocket limit or maximum has been reached, the plan will pay 100% of that person's or that family's claims the remainder of the calendar year. Merits has added additional programs and resources within the Cigna Medical Plan to help you along your health and wellness journey at no additional cost to you. These resources apply to both medical plans. The first resource is the My Consult Cleveland Clinic Second Opinion Program. If you're enrolled in one of the Cigna medical plans, you'll have online access to submit medical records and diagnostic test results and have Cleveland Clinic physician experts review them and give you an online medical second opinion. This includes providing treatment options or alternatives and recommendations for over 1,200 diagnoses without having to leave the comfort of your home. And these second opinions are provided at no cost to you or to your family members if they are enrolled in the Cigna Medical Plan. If you'd like to take advantage of this resource, log on to the website shown here and follow the steps below. There will be 7 steps to request a second opinion. Once you've submitted your request, you'll be notified by email when your online medical second opinion is ready for you to review. If you have questions, you can call the My Consult Clinical Operations Office via phone or email shown on this slide. Next program is Healthy Pregnancies, Healthy Babies. This program provides expectant mothers with the information and support they need to optimize their chances of having a healthy, full-term pregnancy. There is no cost to the member for this program. It helps to prevent high-risk pregnancy and premature births through early risk detection and ongoing monitoring and coaching, including the important step of watching for signs of postpartum depression. If you're expecting a baby and enroll in the program, a Cigna pregnancy specialist will interview you to understand your history. You'll be provided with links to online maternity information and resources and a pregnancy workbook to help you and your coach stay in sync. Enrolled members will also have access to unlimited coaching calls, which will provide caring support so that you, your OBGYN, and Cigna can work together for a successful outcome. To make this program even more enticing for you and to inspire and motivate you as an expectant mother to do everything possible to care for yourself during pregnancy, You will receive incentives once you enroll and complete the program. The incentives are delivered via Motivate Me, which is an integrated platform on mycigna.com and the Cigna Healthy Pregnancy app. If you enroll during the first trimester of pregnancy, you will receive a $150 incentive upon completion of the program. And if you enroll during the second trimester of pregnancy, you will receive a $75 incentive upon completion of the program. The incentive dollars can be redeemed for various gift cards available through the Motivate Me platform. If you are expecting, call Cigna at the number on the back of your ID card. Hinge Health is another program available to you. Cigna Health Plan members will have access to this program, which is a 12-week coach-led at-home digital exercise therapy program for those with chronic back and joint pain. Preventive and acute therapy programs, as well as therapy following surgery, are also available. Therapy programs for women's pelvic health will also be available starting January 1st, 2024. If you're interested in this program and are enrolled in the Merits Medical Plan through Cigna, go to hingehealth.com/merits or call the number on the screen and complete the online screening process to see if you qualify. If you're approved for the program, you'll be provided with a free tablet and wearables, unlimited health coaching, and personalized exercise therapy. You'll also receive help with weight loss and low mood, which contribute to chronic pain. There's no cost to the member for this program. Final program available to you is the Omada Digital Lifestyle Change Program. This is a digital lifestyle change program that can help you lose weight, feel fantastic, and develop long-term healthy habits. For those who qualify, the Omada program includes a wireless smart scale to monitor your progress, weekly online lessons to empower you, a professional Omada health coach to help you keep on track, and a small online group of participants to keep you engaged. You or your adult family members, 18 or older, are eligible if enrolled in the Merits Medical Plan offered through Cigna, are at risk for diabetes, and are accepted into the program. To see if you're eligible, go to omadahealth.com/merits and take Omada's 1-minute health screener. If you already have a diabetes diagnosis, you are not eligible for the Omada program. The purpose of the Omada program is to try to identify those who may be at risk for diabetes and try to prevent them from progressing to diabetes. However, those with a diabetes diagnosis may be eligible for a similar program through the Express Scripts Diabetes Care Value Program. If this applies to you, contact Express Scripts at the number on the back of your prescription ID card for details. I'm sure most of you want to keep the amount you have to pay out of your pocket for healthcare costs as low as possible, and you want to be able to make your HSA dollars last as long as possible too. Spend just a few minutes to find the best prices and quality for the healthcare services you may need. There can be a significant difference in your out-of-pocket costs depending on where you go for your care. To help you with that process, compare costs for different physicians and facilities for most outpatient screenings and procedures and some inpatient procedures in your area, which also includes quality ratings on Healthcare Blue Book's cost comparison tool at the website shown on the screen. The Healthcare Blue Book site will show the average cost charged for the procedure and a list of the Cigna in-network facilities and physician names with red, yellow, or green designations next to each name. Those coded red are facilities charging the most expensive rates, higher than the average cost listed. Those coded yellow are the facilities that charge at or slightly above the average cost listed. The ones coded green are the facilities with the lowest rates below the average cost shown. When you use Healthcare Blue Book and select green providers for a service showing as Go Green to Get Green on their website, you can earn up to $1,500, which is 1,500 points, in reward points for making effective consumer choices and possibly lowering your out-of-pocket expense. Providers coded green without the Go Green to Get Green designation for that service are not eligible for you to earn award points. However, by using green providers instead of those coded yellow or red, you will still lower your out-of-pocket costs. Another great benefit for Cigna members is telehealth. Telehealth gives you access to video or phone consultations with a medical provider from the comfort of your own home. If you're sick and don't have time to wait for a doctor's appointment, or maybe you're traveling away from home, or your child is sick after your physician's normal business hours, you can get access to care for non-life-threatening conditions such as those listed on this slide. Telehealth providers offer you on-demand access 24 hours a day, 7 days a week, 365 days a year to cost-effective, quality, non-urgent care. These providers are all licensed, board-certified U.S.-based doctors, including pediatricians. Using the services of a telehealth provider is less expensive than an emergency room, urgent care, and in some cases, less than your primary care physician. You have 3 options for telehealth if you are enrolled in the Cigna medical plan: MD Live, Cigna Behavioral Health, and any Cigna in-network physician who offers virtual or telehealth services. If you use MD Live, a consultation charge will be billed to your Cigna medical plan for each telehealth visit and processed the same as any other physician office listed. Your portion of this charge will vary depending on whether you have satisfied your annual deductible or out-of-pocket maximum for the year. We recommend that you go to the MD Live website and register online prior to needing services, so you are ready to use this service when needed. When you do need care, and contact one of these providers online at mdliveforcigna.com or by phone at 888-726-3171, you will first speak with a coordinator who will locate the next available doctor and prepare the patient for the consultation. The doctors who provide the telehealth visit can also prescribe medication when appropriate and send the prescription directly to your pharmacy. Cigna Behavioral Health provides access to video-based counseling and medication management for issues like anxiety, depression, grief, stress, family and relationship issues. Providers are available during normal business hours, not 24 hours a day like MD Live is. Consultation charges for their services are billed to your Cigna medical plan at the same negotiated rate they would charge for regular office visits. Cigna now covers telehealth services for any in-network provider who provides those types of services, in addition to MD Live and Cigna Behavioral Health, and claims would be processed the same as any other office visit. Information about your telehealth coverage and contact information for MD Live and Cigna Behavioral Health can also be found on the meritsbenefits.com site under the Health tab, then select Telehealth. If this is the first time you are enrolling in the Merits Medical Plan, you can access your digital Cigna ID card on or after January 1st by registering at mycigna.com or by downloading the MyCigna mobile app. Cigna does not mail ID cards automatically. However, you can go online and request to have a card mailed and sent to you if you prefer to have an actual physical card instead of just the digital card. If you need more detailed information about the plan, such as what services are not covered under the plan, you can refer to the Summary Plan Description, or SPD, on the meritsbenefits.com website on the Medical Plan page. If you have questions after reviewing this video and the information on the meritsbenefits.com website, call Cigna at the number shown on the screen or the Merits Benefits Department at 636-827-4088 or email benefits@merits.com.